Alrighty then. I have no, I have my voice. Thank you. All right, it's 11. We're coming back into session as the Board of Health. Amanda, could you call the roll, please?
Commissioner Richardson?
Here.
Commissioner Thayer? Here. Commissioner Schroeder?
Alrighty, we have a quorum, and as I said earlier, Dallas is out of town taking care of some family business. So with that, I just reconvened as Board of Health. Is that enough? Yeah. It's good enough for me. Okay, Dwayne, the floor is yours.
Good morning, everyone. There we go. Before we get started, I did want to add a quick update. Commissioner Thayer, you had inquired through channels about the situation at Good Samaritan Society and Simla and wanted to know how many folks were, and I think you can see it up there. I did connect with the Social Services Director at Good Sam, and as you can see, they have 26 residents, 11 of them effectively Elbert County residents, and 34 employees with 18 living in the county, others from surrounding areas. So, disheartening to see that the facility is closing, but not at all surprising given the state and national situation with rural hospitals, rural healthcare facilities, skilled nursing facilities closing due to a variety of factors, staffing issues, financial reimbursement issues, multi-layered, multi-dimensional conversations on just all that it takes to keep facilities like this open. And unfortunately, I don't think we're going to have a resolution on those things anytime soon. Okay, generally, very quiet quarter, so no super big news to share. Again, these are our foundational public health services that we're striving to stand up in a variety of ways. This is a marathon, not an annual sprint. So I want to start with the staffing update. So in early March, one of our nurse practitioners, our family nurse practitioner, vacated the role in favor of a full-time opportunity in the metro area. We have that vacancy posted. We're pleased that we've thus far had several good quality experienced candidates. So we'll keep that position or that posting up for a while longer and see what else comes in, and probably in the next, I would imagine, 2 to 3 weeks, start interviewing potential candidates. The finance and grant specialist is a new role. That position is also posted. We've had a couple applicants for that as well. Hopefully one of those is, one or more is a viable candidate. And then the third role that I need to get rolling on is the Public Health Emergency Preparedness Coordinator. I probably have that position description halfway written. We'll get that submitted in the next couple weeks and posted. All three of these positions are funded through various grants from the state, from CDPHE. The first two, the nurse practitioner and the grant specialist, are funded through a public health workforce grant. Don't know if you recall, that grant initially was only good through June 30th of this year. Because we did not avail ourselves of all of the $141,000, we have been granted an extension to June 30th of 2024. So we're well-positioned there for the next year plus. The Public Health Emergency Preparedness Coordinator, 3/4 of that role is funded through the FEP, the Public Health Emergency Preparedness Grant, and I want to say that's $54,000 and change. And then, just learned this probably about 3 weeks ago. Elbert County, previously unknown to me, is included in the geographic footprint for a city's readiness initiative that primarily focuses on metro counties. By some measure, and I don't claim to understand it, but they included us, and so they're giving us $24,000 and change. So I submitted that budget last week. So we have $75-ish, $77,000, somewhere around there, to fund this position for the Public Health Emergency Preparedness Grant, and that is to solely focus on emergency support function number 8, which is all the public health functions. So this could be work that entails anything from, obviously, wildfire, tornado, but also communicable disease outbreak, you name it. Anything that we would need to respond to en masse that would require the resources of many departments and many experts. This position will spearhead that. To my knowledge, the health department has never had this role in its existence, so this is an opportunity for growth, and this position will also work to just get all our ducks in a row, get all the policies and procedures and training and things like that, and obviously we'll work very closely with the Office of Emergency Management.
Are those generally ongoing, recurring grants, or is?
The FEP grant is new to my knowledge. The city's readiness initiative, I believe, is fairly new. So I think to the larger question, should this funding expire or not be renewed in whatever fashion, I think it's expected, wished that counties will adopt those costs in their budget prospectively. In some ways, you know, the proverbial unfunded mandate. We've got to do the work. We currently don't have the bandwidth.
Well, I was going to say, anything we can do to build the foundation we need, if it's not recurring or we just can't afford it to go forward, certainly, you know, front load the planning and foundational work, so.
Understood, yep. Our public health clinic operations are growing slowly but surely. This quarter we served, or January through March, 41 clients, 28 adults, 13 pediatric clients, a few immunizations. The urinalysis drug tests have been fairly steady. Have some other lab visits. There's been a couple tuberculosis skin tests conducted and COVID tests mainly at the county jail. Our public health nurse, Sarah McIntosh, shared with us this morning that she's had a lot of inquiries about shingles vaccines, so that's something we're going to explore. We'll probably look at doing some type of non-scientific survey on asking the community how many folks would be interested in that, because there are obviously costs associated with it, and we need to look at reimbursements from Medicaid, Medicare, and private providers, and kind of run the numbers on that. But that is, I think, probably a service that will look very closely at offering prospectively. And I think it's a 2-shot series, is that right? So anyone that's ever had shingles hopefully would rather have the vaccination than the infection, so.
Yeah, actually, I was going to ask if somebody has had shingles, does this prevent reoccurrence, or is it something, okay.
Yeah, I had it years ago and can just share that it's not fun. And I think the Shingrix is the commercial name for it. But it's only come out in the last, 5-6 years maybe? It's not a long-standing vaccine, so. We're also now a lab draw site for Quest Diagnostics, Quest Labs, anything that you would typically go to your primary care provider for labs, we can do here as a matter of convenience, so we encourage folks to take advantage of that local resource. Similarly, if employers or anybody else is interested or needs a tuberculosis skin test, even members of the general public, we can do that. And we're continuing our communications for a variety of the garden variety communicable diseases that we see throughout the year. Environmental health, due to weather, we had kind of a, just say stormy quarter weather-wise. That's stunted some of our environmental health team's ability to really get rolling. So the numbers are down for the quarter, but definitely weather-related. Have no reason to believe that they won't pick up this quarter and beyond. And there you can see the volume of inspections and the revenue. Vital records is going really well. More and more folks are aware that they can get their birth certificates and death certificates locally rather than having to travel outside the county. 2/3 of our issuances are for birth certificates. We can also, for folks that need one that may be out of state now, we can mail those via secure mail, U.S. Postal Service, priority mail is what I'm trying to say. A little bit of revenue certainly covers staff time for the issuance of the records. Our biosolids application, again, this is through Metro Water Recovery. In my time in this role, I don't recall the biosolids being applied during the winter. So I was a little bit surprised at their continued application. All of them are in the very far northeast corner of the county. And Township 6 South in 57 West. I want to make sure folks are aware of, first of all, that they can report a public health concern, and then secondly, how to do it. So this falls under our consumer health efforts, which are the responsibility of the environmental health team. So that's everything from a complaint about a restaurant, a food truck, a well, a rabid animal, anything. Call us, or better yet, log on to the county website and just put in the search box, report a concern, and then the documents, online documents for reporting the concern will pop up, and you simply fill that out. Fill out as much information as you can or as you are comfortable with. Know that because this is a matter of public record, if you choose to include name, phone number, things like that, that is potentially discoverable through open records. I would say, we don't get a whole lot of concerns, but when we do, obviously people want a response and, want something done. And our environmental health team does a great job of taking the information, listening, not prejudging anything, going out and looking at the situation in the event of maybe an unlawful sewage discharge at a property or wastewater discharge. Generally, if it involves restaurants, Stacy Reinhardt has just such a good and ongoing relationship with all the food vendors, restaurants, grocery stores. Typically, it's a training issue with staff, and she'll review the rules and regs and what training needs to happen. And I don't know that maybe once a year we get a second complaint, but usually the business, restaurant, homeowner who is the subject of the complaint fixes what they need to fix, and it's done with. So, and we always take an approach where we're educating and informing. I don't know that we find anybody or even threaten to find. So,
Ask for the waste discharge. Is that primarily people dumping RVs or failed septics? Or
I think, I suspect, based on what because I took that one over the phone, I suspect the septic tank was full. The leach field was probably in need of repair, and they were evacuating their septic on their property. When Stacy went out, she didn't see any evidence of recent discharge, and so no action was taken. So,
thanks.
and the link is up there for reporting a concern. On the health promotion side, the WIC program has resumed. Just by way of update for WIC clients, WIC clients will need to come in person prospectively to get a current height and weight for their infant or toddler, as well as a current hemoglobin test, which is just a finger prick and a couple drops of blood. During the pandemic, all of this was done, or the check-ins were done virtually. That is going away with a hard stop in August, but WIC staff is effectively messaging currently, you need to come in now, and they will set the appointments, set their future appointments from there on out. So we'll have hopefully more and more folks in person, and getting that, not just re-upping their benefits, but nutrition counseling and several other assessments. I have the first bid from a consultant for a deeper dive on the behavioral health needs and services, so that we can get a better understanding of some of the issues that are creating challenges. Particularly, we had an initial meeting with Elizabeth Fire Rescue where they shared a significant proportion of their calls are behavioral health related. Just trying to get a better understanding of what we can do on the health promotion side, whether that's referral to resources, as well as laying the groundwork for future applications for funding to foundations, where we can work with community partners, whether that's behavioral health service or the collaborative management program, the interagency operating group, human services, whomever, schools, that we can really begin to tackle the behavioral health challenges that everyone experiences in some form or another. Lisa, our health educator, met yesterday or Monday with Douglas County Health Department, who's supporting the state tobacco education and prevention program that's paid for with tobacco taxes. And they're going to start with a community profile. Once I think we get through this school year, and a lot of this work will be connecting with school nurses and other school personnel. Once we know which school nurses have re-upped their contracts, that we can get rolling on the next academic year and connecting with them. And then we write a almost weekly column in Ranchland News on Public Health Pulse that just focuses on a variety of public health issues. We're always looking for ideas or issues that folks would like to hear more about. So if anyone has questions, comments, suggestions that you'd like to hear anything about, please let us know. And that's it. I'll ask staff, is there anything y'all want to add? I do want to share an incident. This happened last week with the rabies, or was it the week before? So there was a county resident that was potentially exposed to rabies from what sounds, by all indications, like a rabid horse. Very, very unusual to hear about a rabid horse. There's maybe, I don't know, 25 or 30 documented cases of rabid horses nationwide in the last 8 or 9 years. This horse was put down by the owner. During the course of removal of the horse, body tissue, blood, fluid splattered on the individual that was moving the horse. The challenge was the horse's presumed or potential rabies condition was not proactively communicated. Only after removal did the person find out from a veterinarian that the horse had most likely been rabid. So just a reminder for all the horse owners in the community that you do need to get your horses vaccinated for rabies and some other things. That is the proverbial herd immunity that we're talking about. So that we're not putting any folks in harm's way. But as you can imagine, the person that was exposed was pretty angry, which, to my point, necessitated initiation of post-exposure prophylaxis vaccination, which is a series of four vaccines over 28 days at a very significant cost. So prospectively, we made the decision because when you're potentially exposed, you think you're exposed, you are exposed, you need that first vaccination in the series ASAP. A lot of times, we've just got 2 pharmacies in the county. They don't have that. So we made the decision to carry that first vaccine at the health department. Has a shelf life of a little over 12 months-ish. So we'll incorporate that cost prospectively in our budget. We just need to get through, seasonal rabies and your typical rabies season from spring to fall, and just have that as security measure for anyone. And then, once they get the first one, there's time to order the subsequent doses. So, yeah, do you want to add anything to that? Yeah, call Stacy, our environmental health specialist. Stacy knows the procedures, knows what to do. First call we've had in my time here that it's been a large animal. Usually it's a bat, a raccoon, a squirrel, something like that. So, and then that's it. Questions?
What area of the county was the horse in? Is that?
Sorry, I'm going to repeat this just so that everybody can hear it. The reminder to the community is if you have an animal that you suspect has rabies that's acting unusual, don't hesitate to call us. And if you have anybody that's going to be handling that animal, please prevent the exposure in the first place. Call us, let us know. We'll help walk you through the steps that need to happen to safely dispose of the animal or test if we need to. Thanks.
When you say acting unusual, what does that mean?
I'm told by the person that was exposed, like stereotypical foaming at the mouth, in this case. Yeah. As opposed to, we have tested squirrels that, by all understandings on my part, it was a squirrel acting squirrely, but out of an abundance of caution, we tested the squirrel. Sometimes just leave the animal alone if it's a squirrel. It's tough to make the call from a phone call that's a squirrel acting unusual. I don't know what typical behavior is for a squirrel. Commissioner, to your question, what area of the county? This was actually an exposure from a horse in Douglas County of an Elbert County resident.
They'd gone to dispose of the animal.
Yeah, it was out in Sedalia, I think, and they got called for a pickup and went out there, and then only when they got back did they understand the full story. So it was not an Elbert County horse.
All righty, well, appreciate that anyway. Yeah, I know after the last few years, just rowing the boat is a good thing. So I appreciate all you're doing. And so thank you to you and your full team. So thanks.
Lastly, I just want to recognize the support from other departments, particularly finance. We have many, many grants that have many, many reports and many, many budgets, and for the life of me, I can't keep them all straight. So finance team is a great help with those submissions. So I want to recognize them.
That is good. Anything else? No? Much appreciated. I guess with that, we'll close the Board of Health, and then I would accept a motion to adjourn for the day.
Mr. Chairman, I move we adjourn for the day.
I'll second. We have a motion and a second to adjourn. All in favor, please say aye.
Aye.
Aye. Motion carries. We're adjourned. Thank you.